Dr. Dubey, thank you so much for taking the time with me today. I'm excited to hear about what you're working on with AliveCor. You know, AliveCor really is a pioneer in health tech. Here we are at this meeting seeing a lot of health innovation. I know you haven't been with the company for that full 10 years, but I just wonder if you could start by just talking at like a macro level about what it's like to see all this innovation happening and how that innovation ecosystem has changed over the last few years.
What I've seen from the vantage point of the patient and the clinician, that we have become very patient-centric. As I go around in the arena, so to say, of all the digital health innovation, more people are focused on member engagement or patient engagement. And then the secondary layer is provider engagement. So the clinician has become the second focus, in which they're looking at efficiency, they're looking at health economics of like cost savings, and almost kind of having these doses of time with the clinicians measured, so it's the right care at the right time. And I'm so glad that technology is really impacting that, because all of that was organically grown over time, and technology is giving superpowers to both the patient and the clinician. And now it's slowly getting into the health system levels and the payer side. And I'm really hoping that they wake up to the moment and really connect all of the dots together for the patient.
Now, AliveCor has done a lot of work over the years to clinically validate their device.
Yes.
And a lot of the startups that we see here and that I work with, they're still struggling with that step. And I know this is a piece that you work on and is close to your heart. And I wonder if you have any advice for a founder who is in the early stages of clinical validation, maybe deciding how to go about it, trying to decide what their priorities should be. What's some words of wisdom for them?
Well, I would say that either the innovators or founders could be coming from the angle of the patient, or they could be solving a pain point for the provider. So I would definitely focus on user research, because that is something that I say that AliveCor has had 3 lives.
Okay.
So one life is inventing. So we went in and we saw what the pain point for the patient was, is that they had to make an appointment to go get their ECG done, or EKG done, whichever word you want to use, the same thing. So EKG done in the doctor's office, getting an appointment, taking the clothes off, getting the stickers on the chest, God forbid there's hairs on it, getting those shaved off, and then somehow getting a large bill that comes at the end of it, were all pain points for the patient. For the doctor, there were pain points on like the time spent to do that EKG, and then somehow the primary care physician may not know how to read it, so then the cardiologist is needed. So we saw that pain point. So I would say the founders need to go sit in a waiting room to see what the patient is going through. Or now in a virtual waiting room, because the virtual care is happening, to see what the pain points are. So virtual care has crossed the bridge of brick and mortar, but there are so many things that the patients are still asking for. So if you are looking to solve for the patient, try to interview as many patients as possible in the vertical that you're trying to solve for. From the clinician perspective, ask them what is bothering them. So there is a lot of interoperability things, integrations into the wearables like Apple Watch or even cardio device that we make. How are they flowing into the clinician's office? Those are things that need to be solved for. And all of the founders, if you're looking at either of these spaces, look there. And then third is the payer of healthcare is the third P that becomes important. They're looking for outcomes and cost. So if you're looking at innovating that space, talk to as many employers who are self-insured, as many health plans who are paying for the cost, and like see what you could solve for them. Like I said, AliveCor has 3 lives. First life we were inventing. So we worked a lot with clinical validation. So we worked with studies, academic institutes to get our devices FDA cleared. The second life is where we were delighting the customers. So we have a very strong direct-to-consumer offering in which our devices, our care subscriptions, and our telecardiology visits that's available now in 37 states is live to kind of help people to solve for the access issue. And our third life that we have launched is the enterprise life. So we don't want to ignore the people who are under the coverage of health plan. So we have gone into serving the employers and payers. We are open for business for employers and payers and health systems who are assuming risk on the outcomes and cost. So that is what AliveCor is doing. It's like start somewhere, keep building upon it, get really good in that vertical, and solve for all the 3 Ps as you can.
Is there room in that structure for global health? I think about the power of a mobile EKG in resource-constrained environments.
Absolutely. So access to care is the resource-constrained environment. We are present in 47 countries today. We are enabling our cardiologists, our primary care physicians across the world, and even the nurses, so that they can give a device to the patient who may be in a remote rural place. And so you just talked to Jenny, for example. She's solving for the last mile for that rural part of US. You know,
Jennifer Schneider from
yes,
Homeward,
Jennifer Schneider for Homeward. She just launched it. We could enable their cardiovascular space through a tech enablement of the clinician when they are out there in the rural, when they don't have access to a cardiologist. Our 37 state network can help support that, for example.
Got it.
So that those are the kinds of innovations that need to happen at the last mile, and we would like to enable that to solve for the patient and the provider.
What I hear you saying is you're moving from really a focus on the device, everyone associated AliveCor with an object, to really having this this platform that extends into the community. Is that right?
Absolutely. So device alone doesn't do anything. So we know that wearables is a question mark, right? A device with data and the clinicians tied into that makes it actionable for the patient. So the patient doesn't know what to do when they look at these squiggly lines on the grid. That's the ECG. But if you now add the data into the hands of a clinician, whether it's a cardiologist or a PCP, and they are able to monitor them, or they're able to give medications to them at the moments that matter, that is when it becomes powerful. So we serve our clinicians through AliveCor Labs, for example, in which we do 24/7 monitoring for patients who have unknown reason for palpitation, unknown reason for strokes that are happening. And so we are able to diagnose them in odd times where common things like other monitors can miss. We can be a prolonged monitoring so we can catch that specific arrhythmia that could have caused the palpitation or stroke.
That's exciting. Dr. Dubey, thank you for taking the time with me today. It has been exciting for me to watch over the last decade as AliveCor has evolved, has been such a pioneer in this industry, and now to hear from you that it's really going beyond the device into the community and creating this really data-driven platform.
Absolutely. We are open for business for employers, payers, and enterprises. All the health systems come and talk to us.
All right. Thanks, Dr. Dubey.
Yes.
All right. Be well.